I'm excited to introduce our next workshop titled Thriving Together, Strategies to Navigate Burnout and Enhance Well-Being. For this workshop, we have the pleasure of learning from Ms. Avni Panchal. Avni is a Title IV-E alumni and holds an MSW from the University of California, Berkeley. Avni subsequently spent 10 plus years working in child welfare. Avni currently holds a pupil personnel services credential and is a licensed clinical social worker. Her current work involves operating her own private practice, offering individual and couples therapy, along with coaching services focused on empowerment and relationship development. She officially trains child welfare workers and mental health professionals across multiple regions, and she is an instructor in the social work graduate program at San Francisco State University. Yes, she is committed to fostering a learning environment emphasizing strength-based approaches and cultural responsiveness. Please welcome Ms. Avni Panchal.
Good afternoon. Happy Friday. I had this lovely imagination that I'm going to be able to go through 30 slides, so we're going to see how far we go. These are some of the learning objectives that I hope to get to. I really want to talk about secondary traumatic stress. How many of you have heard of this? Awesome. Okay, we're going to talk about secondary traumatic stress. I also want to talk about the cultural implications of productivity. That is one that I struggle with, and I know I am not the only one. I see you nodding. I am not the only one that struggles with that, so we're going to talk about that. And then we're going to talk about boundary setting. How many of us are like, I'm a pro at boundary setting? Okay, y'all got to talk to these people in the back, okay? But I want to make sure we talk about boundary settings and then manage our time and then learn several ways for self-care. Now, I will say, most of this is going to be like friendly reminder. I'm not giving you any miracle drug or pill or like fascinating strategy. These are going to be things like, oh yeah, I should do that. So just keep in mind to like lower your expectations. It's not going to be this grand thing that you've never heard before. It's just one of those moments where if I'm burnt out, some of the first things to go off is my self-care. So this is the place where I'm hoping that I can remind you to bring it back in your daily work. So a little bit about me. And like Christine was saying, when I did put up this slide, I'm like, can I write all this? Did I do all this? But I did. And so my imposter is going to take a seat right now, and I'm going to allow myself to share all the things I have done and why I want to talk about burnout in child welfare. So William did a wonderful job of introducing me, so I'm not going to go into like I'm licensed this, then the other. I am licensed in 5 states. During the pandemic, over a glass of wine, I'll tell you why I decided to get licensed in 5 states. But it's actually not as difficult as people make it seem. They just want your money. And if you've taken the test, most of the states will have reciprocity. So I just want to burst that bubble right there because I thought, oh my God, it's going to be so difficult. It's not. Just keep up with the continuing educations. So I have worked in child welfare, and I've done every single program. As a direct practice worker, I did every single program except family maintenance and family reunification. As an intern, I actually had the privilege to work in every single program. So I am one of those social workers that moved around. I have a lot of respect for folks that stay and know the position and do it for 10, 15 years. I was your social worker that moved around. I actually picked MSW because I liked that it had more options. So y'all can see I'm a busybody. You're going to learn about that. And then I do train child welfare workers. So any of you in the Bay Area, in the northern region, you're probably going to see me in your Common Core curriculum trainings. It might be a good or bad thing, but you're going to see me again. And then I do train at SF State. So why is this a conversation I want to have? Because it's very personal for me. And the reason why it's personal for me, and I know this is not my story alone, but I'm an immigrant child, and I'm the oldest sibling. Anyone older in this room? Okay, no shade to anybody who's not the older sibling in your group. I'm not saying that you are not responsible. That is not what I'm saying. But I do know for me, that is my story. I am the oldest, and I am the person that everybody comes to. Anybody have that regardless of your order in your family? Yeah, a lot of us get into social work for that reason, right? So I'm an immigrant child as well. I immigrated to this country when I was 13. So I know busy. I know busy. I'm a busybody. How many of you are busybodies? Okay, my live audience, anybody telling me about their experience? Okay, all right, cool. Yeah, busybody. I'm so, oh my God, if I could be busy and fill in every hour of my minute, I will. That's the reason I can't even stand on a damn podium. Like I have to move around because I really am busybody. My partner knows this. When we first started dating, he's like, "Do nothing," and I'm like, "I don't know what the hell that means. Like, what do you mean do nothing? Just sit there and do nothing? No idea." So I didn't learn about self care until graduate school. I didn't know the word self care, and when I got to grad school, I was like, what does that mean? Like, do you just take care of yourself? What does that mean? And especially as a person of color, I was like, what does that mean to take care of yourself? No one's ever told me to take care of myself. Everybody's told me to take care of everybody else except me. So this was something that I really had to learn because I wasn't taught about self-care. I wasn't taught about boundaries. I wasn't taught about self-compassion. And so my very first year, being the super social worker that I imagined to be, I said yes to everything. How many of you are in that position? Saying yes to everything. Yep, see, I got y'all. I know. I got sick out of exhaustion. I got sick out of exhaustion. And I had heard about people getting sick of exhaustion. But I was like, I'm healthy. That's not going to be me. That can't be me, right? But I did. I did not take a single pill or medication. I just rested for 2 days. And that's what got me through my exhaustion sickness. But that was a really good reminder and lesson for me to start learning to say no. We're going to talk about what it means to say no because it's very difficult for us in the helping profession to say no. And I've burnt out at least twice in my career, like the 10 burned to a crisp. Yeah, I've been there twice. The other times I've been at like 6, 5, you know. And in this journey, I've also learned to start saying no and shed the belief that I'm a bad person if I'm saying no. I know a lot of us feel and go through that, right? So I really understand the necessity of self-care. Back in 2017, when I was like imagining that I could do a million things, which I still kind of do, but I'm really boundaried now. Um, I was working 60 plus hours for 7 to 8 years. That means I had my full-time child welfare job and I had two other part-time jobs. Yes, I did. I really did. And I thought I could do it all. The reason I actually didn't burn out was because I didn't know I was doing this back then, but I actually had set boundaries that I didn't realize I had. Like no one could have told me back then, how are you doing it, until I actually slowed down and realized. So Sunday used to be my day where I wouldn't work. So I worked Monday through Saturday, but Sunday I did nothing work related. It was my personal day and it was the day that I did anything I wanted. That's what kept me going. So when I say it's personal for me, I'm telling y'all, I've burned to a crisp and I've worked my butt off when I really could have slowed down. So I really want to have this conversation because I know it's personal for others as well. So let's take a poll with a show of hands. Which one of these, and I know I'm asking for just one because I know the minute I put this slide, y'all are like A, B, C, D, and E. Which one of these do you struggle with the most? So A is setting boundaries and saying no. B is prioritizing rest and sleep. C is engaging in hobbies or enjoyable activities. D is seeking support from others. And E is practicing mindfulness or relaxation techniques. So if you were to just pick one, and I know I'm asking just one, who are my A's? Okay, we got a few for setting boundaries. Anybody in, how is the conversation on the live? Because I would love to know if they're putting anything in chat for A's. We got a couple? Okay. Prioritizing rest and sleep, B. Yeah, that also falls off when burnout happens. Any B's on our live stream? We got a couple, okay. What about for engaging in hobbies or enjoyable activities? Yeah, that's also something that falls off when I'm burnt out because we think I don't have time, so the thing that I need to drop off is the thing that I actually enjoy. It's actually the thing that's going to keep you sustaining, but we think that's the thing we need to drop off. Any on for C in live stream? We got one. Okay. Seeking support from others. How easy is it for okay, yeah. Asking for help. We love telling our families and youth, please ask for help. And then we're like, yeah, but not me. You, not me, right? So, absolutely, that's another one. Any D's on the live stream? We got a couple. Okay. And then practicing mindfulness or relaxation techniques. Yeah, yeah. How many are familiar with mindfulness? Yeah, we're going to talk about mindfulness. It actually really changed my life. And as a busybody, I was like, you mean just sit here and do nothing? Like, okay, I'll try it, I guess. So I want to talk about this idea and this notion of moral distress. How many of you have heard of this term? A couple of you. Okay. So there's been research done in your box link. You have a one pager that's going to show a little bit more data from this. So this was a study in 2020, and they did surveys with about 1,879 social workers across United States. So it wasn't just specific to California. And they first defined what moral distress was. So moral distress is when, as a professional, you know the ethically appropriate action that you want to take. But you can't take that action because of internal reasons. Maybe there's fear, maybe there's guilt, maybe there's shame, something internal, or for external. Your institution doesn't allow you to do it. There's an agency policy that's against that, that you cannot act on. And so they asked, defining that being the moral distress, they asked individuals, how many of you have experienced moral distress? And out of the 1,879 public child welfare workers, about 60% said they have. How many of you, and I'm going to ask a question later about how many of you have experienced that, so keep that in mind. Of those individuals, for the 1,800 folks, more than 40% reported that their job required them to do things against their better judgment. What this leads to, and you all will not be surprised by this, is low psychological safety. And when I say psychological safety, I really mean your ability to take risk, your ability to feel like you can speak up in an organization and not have consequences that are negative by your organization or by your management. They also reported job stress and time pressure that increase the likelihood of experiencing moral distress. Sound familiar? Yeah, absolutely, right? So I want to also take some time to talk about mental health. So another study also during the pandemic, and there's a one pager for this in your box link as well. 86% of US workers reported at least one mental health challenge. 33% received treatment or support. Only 33% received treatment or support. And 70% of workers reported at least one symptom of secondary traumatic stress. This is during the pandemic, like 2020 to 2023. And the rate of our mental health, and I also don't like the word issues when you were talking in your workshop, but the rate of mental health symptoms, depression, anxiety, and post-traumatic stress has doubled from 4% in 2021 to 8% in 2023. Severe or chronic depression or anxiety has increased from 8% to 2020, in 2021 to 10% in 2023. So, knowing what I just told you, how many of you have experienced moral distress? Okay. So take a minute, just like 2 minutes. I really will like stop you at 2 minutes. Talk amongst with your peers. How has it impacted you? Let's start with any comments in the live stream that are telling me about their impact, if any.
Yeah, one was the loss of confidence over time.
Okay. Yeah. Anybody want to share? Like, I'll take one or two responses from either side about impact for moral distress. Yes. Oh, yeah. Oh, yeah. Yes, absolutely. Others, you take it home with you. That's what the person said. Nightmares. Yes, we're talking about secondary traumatic stress. Yes. Oh, yeah. Oh, yeah. Your body knows. Your body knows. Anyone else? Final comment. Yes. Yes. I'm in the room, but not really. I'm here, but not really. Disassociation. Absolutely. Absolutely. Okay. So, knowing that, let's talk about this notion culturally of progress is bigger and more. We live in the United States and we center on progress. Progress is bigger, better, scalability. We're doing that every time. When we meet our friends and our family, we're talking about how busy our schedules are, right? We're doing that often. I'm going to talk about it in productivity as well. But if you are thinking about progress is bigger or more, that really means that the belief that we're centering on, and I'm not saying we agree with this, I'm talking about the cultural implications that might be seeped in for us. So I'm not saying anybody's like, yes, I check, agree. But these are things that we've been kind of taught unconsciously, right? In this society that we're living, where we may get 2 weeks of vacation, possibly, maybe. So belief that success and progress is akin to bigger or more, right? So if we center and think about that ideology, it is rooted in capitalism. And capitalism, at the center of it, is most amount of profits with least amount of labor. Guess what that does? When we center on progress, it gives little consideration for the cost associated to that progress and growth and expansion. When we center on productivity at all times, it causes burnout and it also causes loss of staff. I want to also center on this particular quote from Vandana Shiva. She's an Indian scholar and activist who writes, "An obsession with growth has eclipsed our concern for sustainability, justice, and human dignity. But people are not disposable. The value of life lies outside of economic development." So the reason I want to start with this, because I could tell you, like, take rest, drink water, do mindfulness, but it is a systems thing. And I do want to center ourselves first. Before I tell you the individual strategies that might be friendly reminders, we do need to center on why burnout happens. And for my students, they know this in training. If you've ever taken training with me, you know this. I don't talk about burnout if burnout happens. It's when burnout is coming. Because it's not a matter of if, it's a matter of when. It's happening. It's going to happen. So when we center on progress is bigger or more, this sort of is bringing up, oh, sorry, I went back. This is impacting our burnout. The other thing that's also impacting our burnout is the illusion of productivity. This is another thing. Once again, I don't say we agree with this, but as a society, we are breathing and living in this. Yes? Absolutely. So, the illusion of productivity is that it centers on the idea that we always have to be doing something. What I tell you, I'm a busybody. Others in this room are also probably like me. I see a lot of nods in the room as you read that bullet, right? Because we have this notion that we need to center on always doing something. And the culture rewards us for us being busy and working at all times. That's why I said when we meet our friends, we're all talking about, oh my God, my calendar is so incredibly busy, as if it's a reward, right? I've done this. So I'm not sitting here on this high stage saying I'm not, no, I'm with you right there in the middle. And so what it also does, think about what it does to our brains if that's the story. It's going to make us feel bad. And I put bad in quotations because it's the thing we need to unlearn. It's going to make us feel critical of ourselves if we do rest. And so what ends up happening is I got to justify why I'm resting. I got to justify why I'm taking vacation. So during the pandemic, one of the reasons why burnout and stress increased like madness is because everybody was home and nobody was going anywhere. So we didn't feel like we had something to do. So we were working past our 5, 6 p.m. time because we didn't feel like we could justify that my time is my time. How many of us feel that? Uh-huh. Yes, absolutely. So it also makes us worry that we will fail if we don't keep pushing and working harder. And our agencies in child welfare do a wonderful job of telling us you have to keep working. There will always be work, y'all. There will always be work. But it'll kind of keep reminding the cases, the court report, all this stuff, you got to move forward. The other thing I want to also center as a therapist now, which that was a whole journey. One of the inner critics, I do another training on taming your inner critic. So there's 7 different types. One of the inner critic is the taskmaster. Now, the taskmaster's whole job is to make you keep working. Because internally, it's thinking if you don't work, you're not going to be productive. You're not going to be accepted with your friends and society. So I got to make sure you keep working. So when you do try to rest, your inner critic, and by the way, we all have an inner critic. That means it's the judgmental, negative voice in our head. Will say something like this when you're trying to rest. You're so lazy. You should be doing so much more. You shouldn't take rest or time off. You should be working harder. Anyone's voice say that? All the time. Who said all the time? Exactly, all the time. Anything resonating in the live stream, just want to make sure that I got y'all too. It's an illusion. And here's why it's an illusion. It's an illusion because the productivity just says more, more, more. But we're never actually in this narrative set up to feel enough. So we'll never feel enough. It's a never ending cycle that we will never get out of. So it won't make us feel fulfilled. And it'll create this unending cycle of burnout. So the thing that it thinks it's trying to avoid of like you won't burn out if you just keep working and you meet all your tasks, it's going to get you exactly there. That's why it's an illusion. Resonating? Okay, so all of this leads to, and this is not a surprise, but by the way, before I go back to all of this leads to, how many of you resonated with the progress and productivity piece? Yeah. How many of you do that right now? When you feel some kind of way when you're trying to rest? Okay. My folks in live stream, anything resonating?
Yeah.
You're like, I got you. Okay. And this all leads us to, and this is no surprise, right? All of this leads us to secondary traumatic stress. We talked about that at the beginning with the learning objectives. So just want to center us on a couple definitions. If you went to the trauma-informed supervision, I was there in the morning, they talked about it as well. But essentially, secondary trauma is the emotional distress we're going to feel when we hear firsthand trauma experiences of someone else. Every single one of you, if you're in social work, you are steeped in secondary trauma. Because guess what you're listening to? Firsthand experiences of trauma. These are, when someone brought up nightmares earlier, you can have work-related nightmares. You could have difficulty making decisions. And then vicarious trauma, just centering on the definition, is a shift in someone's worldview that occurs when one works with individuals who have experienced trauma. You could have guilt or hypovigilance. How many of you, and I have had this experience where I am with my non-child welfare worker friends, and I will see a grandparent and a grandchild, what looks like a grandchild. My head didn't go there. My head didn't go to, oh, grandparent and grandchild, so cute. My head went to, are they being groomed? How many of you have experienced that? Yes. I also have my best friend's daughter, her niece, she was born normal, 9 pounds. I was in adoptions. I was used to babies being born 5 pounds and under. When I held my niece, I thought she was a 3-month-old baby because in my head, that's what a 3-month-old looks like in my work. That's vicarious trauma. It shifts your worldview. Experience that. Absolutely, right? And then the other things I want to center on as well in the secondary traumatic stress category is compassion fatigue. This is where we have lessening of our compassion over time because of the exposure of trauma and the experiences that we've had. We may have apathy, we may feel isolated. And then all of this, as you can guess, if I'm seeped in it, I'm breathing it, I'm living it, I'm getting to burnout pretty quickly. So I know none of this is a surprise, but I wanted to center us on this first before I go to what do we do about it? Because those what do we do about it are friendly reminders. They really are. So, how do we navigate burnout and thrive? Now, when I was burnt out, I know if I went to a conference and someone was up on the podium saying, you can navigate burnout and thrive, I would have probably slapped them because I was burnt to a crisp and I'm like, who the hell are you to tell me what I can and manage my time? What do you mean manage my time? I have no staff to manage my time. I have 44 cases. What manage time, right? So I put this slide for me when I was burnt out to a crisp at 10, knowing that before I provide mindfulness and self-care strategies, that I don't slap my own self today. So, a few things to consider is I do want to recognize that burnout happens because it's systemic. This is not an individual problem. And someone I think you were in the workshop earlier who brought that up as well. It's not an individual problem. I do a lot of trainings on burnout, and there is the individual piece of what I can do internally, but there's also a systemic piece there, okay? So I am not any way, shape, or form taking away that if I don't have people and I have high workload, I am going to burn out. I'm not negating that. I'm also not negating that your supervisors and management support make or break your job. I don't care how passionate you are about this field. Your supervisor and your leadership and your management make or break your job. I have been very fortunate to have wonderful supervisors. It's probably one of the reasons I stayed for a decade in child welfare because I had wonderful supervisors. But I also want to center us on the fact that supervisors make or break our job. Systemic change is needed at every single level. So I'm not taking that away. And until the system catches up, we have to start taking care of ourselves because the system is not coming to save you. I am so sorry. The system didn't come to save me. It's not going to come to save you. And if you want to do this work, which I absolutely very much want to continue to do, I have to center me first. And as a person of color, that was the most hardest thing to center on. And especially as someone who's like a second mom to my siblings, I don't center me. And my partner and I have had this conversation where I'm like, I think of answering a question when you ask me, where do you want to go to eat? I answer it from whether I burden or benefit you. I always do that. I do that unconsciously. And he's over there thinking like, where do you want to go? Like, where do you want to eat? This way or this way? And if I say something, it's like, yeah, that's what she said. So I know I'm not the only one that does that. Okay? So until then, I want us to figure out what's our locus of control and what are some things we could do. And like I said, these are going to be friendly reminders. None of this is going to be like grand science that you're going to see on my slides, but it's just friendly reminders for us to pick up on. All right? Anything from our live stream before I move forward? Okay. No? We're good.
Yeah, actually,
Okay.
we had a lot of people talking about compassion fatigue, that they were struggling with it.
Okay. And they're resonating with that? Okay.
Yes.
Sounds good. All right. I want to talk about this idea of micro moments of self-care. I could not have told you this 8 years ago when I was working 60 plus hour job of what I was doing But today, me can look back and realize I was doing this. I was doing this every day. I just didn't know I was doing this every day. So, self care, when I first learned it, I thought it's like go get a massage, get nails done, go take care of yourself, take a day off. That's what I thought self care was. And I'm like, okay, well, those don't happen all the time because that's expensive. Like I can't go every week to get a massage. So in my mind, self care can be like micro moments because those big self care, and absolutely, please go get a massage if you want to, go get your nails done if you want to, go do what you need to do. But those don't come as often, they don't come daily. And we need something daily. We need those micro moments of self care that we really center on. And you might all be doing this, you just didn't know you were doing this. And so I really want you to build in my students who are graduating, you about to have senioritis and you're going to start your county jobs. You need to have, and everybody says you need to have a self care routine. I'm here to tell you, you need to have micro moments. That's what I really want you to center on. So, self care, if you didn't know the definition, like I didn't, and in grad school, is a process where we're establishing behaviors for our well being. That's kind of the basic, right? So it really involves us in taking care of ourselves. Child welfare is going to demand urgency from you. It's going to be speeding you up. If you allow it, it will take you 125 miles an hour with no brakes. It will. That's just how the system is built. And so, micro moments, wherever you can find moments to pause and slow down, that will be your best effort to stay above burnout. So I've given you some examples on the right. I'm not going to read it. One thing I do want to point out is before you make any decisions, think of HALT. Are you hungry? Are you angry? Are you lonely? Are you tired? Don't make a decision if any of those are yes. But I want to know from you, what are some of your micro moments besides this list that you see? And I would love if there's any in live stream too. Yes. Oh, okay. Quick walks. I got a minute or two. I got to go back and answer emails. I see your hand and come back to you. And I could do that while I'm taking a phone call that's extremely stressful. Oh, we're going to talk about boundaries. I'm going to come back to you. Okay. Making lunch. Yes. Yes. Anyone else from this group? Please do. Please do. Yes. Yes. Something. Pause and slow down. Anything that I love that you brought that up because it doesn't need to be what I wrote on this slide. Anything allows you to put some brakes. Pause and slow down. That's your micro moment. That's your micro moment.
From the chat, we have stretching, stopping and breathing,
Love.
and taking a break on the porch, and calling a safe person.
Yeah, I love that. I love that. Okay, so y'all get this, okay? I like the examples that we're getting. Okay, so the other thing, because we talked about boundaries, how many of us have difficulty saying no? A lot of us, including me. I'll add myself to the mix. So here's a couple things what happens when we try to set boundaries. The first thing that happens is it makes me feel like I'm being bad. I'm being selfish. And what also happens if you're in a dynamic with someone where you've never set boundaries, those of you, if you've tried setting boundaries with your family members, I have. It took me 10 years, but it's there. We're there now. I'm so happy. What also happens is this pushback or this dial up because they didn't get the memo that you want to change the situation. So they're like, what do you mean you want to leave at 6? You've been staying till 8 p.m. You're going to get a pushback. You're going to get a dial up. And what that makes us instantly feel like, oh crap, I maybe can't put this boundary because maybe I shouldn't have. It's making us feel bad. It's making us feel like we're being selfish. So as helping professions, we think because I'm in the helping profession that I have to be making sure that I'm supporting my people and not saying no. But guess what that's doing? It's only enabling our families. So I'm not saying that means you stop doing work. That's not what I'm saying. But we do want to be modeling healthy boundaries. That means we have to get vulnerable and say no. We cannot expect our families to be vulnerable and we not do that. So having boundaries doesn't mean that we're not fulfilling our work. It means we're centering ourselves and we're allowing ourselves to show up better. So I really want to stress one thing, and I talk about boundaries as well. Boundaries give us short-term discomfort, and I want you to pause and think about the long-term benefit you're going to receive. Because in the short-term discomfort, you're going to get stuck and you're going, never mind, I won't say no. Think about the long-term benefit. So I knew very early on that I love child welfare. I want to still stay connected to child welfare. But I knew I will never be able to keep this going if I didn't center and have some boundaries. And so because I love what I do, I have boundaries. I'm moving past my short-term discomfort for the long-term gain. If any of your jobs have built-in boundaries. You know how they have built-in boundaries when you get hired? They tell you this. You have your hours is 9 to 5, 9 to 6. You have X amount of holidays. You have X amount of sick time. Those are your job's boundaries. Because if your job came to you and said, you work 24/7, 365 days, everybody sign up? We're good? Signing on the dotting line? Hell no. Right? So we have built-in boundaries with our work. We can allow ourselves to also have boundaries. So if you ever have a thought where you're like, oh crap, I can't say no, hopefully you will hear my voice in your head. But if you are really confused and you're like, I'm not really sure how I do this, pick your most important boundary, because a boundary is emotionally exhausting. You don't want to, what ends up happening generally is, oh my God, I'm so burnt out. I'm saying no to everything. And you've never said no to anything. And now you're about to say no to everything. You're going to stop immediately in like 15 seconds. And then we're even more frustrated because I can't even say no, really? So I want you to scale what's the most important thing for your boundary at a 10, and 1 being the least important. I gotta leave work at 6. I've been doing this 8 p.m. thing. It's not working. That's my 10. You drop everything else. You only focus on your 10. Try to be consistent on your 10. The other things will come into place. So if you are new to boundary, allow yourself to only pick one boundary you want to settle with. With my parents, it was like, I'm not calling you every day. So that was the only thing I centered on. And there were a lot of things I could have centered on, but I was like, I'm just not calling you every day. We're going to do every other day for now, and then we'll move forward, okay? So, okay, these next 2 slides, don't look at me sideways, because I know if you're burnt out to a crisp, you're like, you want to tell me about managing time? Yes, I do, but with the caveat, right? These are some tips that helped me as a social worker. Hopefully these will help you. These are not miracle tips, but these are tips that helped me when I started my job. So child welfare is fast paced. You know this. You all are going to use Outlook calendars. Your colleges probably use Outlook calendars. Start having to-do lists if you don't already. Color code your calendar, please, if you don't already. I liked bright colors for like, you really got to start working on this, like now. So purple was my to-do list for, yo, you need to start writing your court report. And I'm a procrastinator, by the way. So I just own that. Lucy knows I've come a long way, y'all. I'm like, this presentation was done a month ago, which is like unreal for me. I would have done this on Tuesday. It's unreal. Seriously. But I put my deadlines 2 weeks ahead. So I'm starting to be like, yo, court report's due in like 2 weeks. Yo, court report's due in a week. If you are like me, put the shame aside, just work with your system. Okay? Have folders that organize your email. You're going to work with a lot of families. Start initialing your email. So when you come in the morning, just sort some of them are going to be a lot of CCing from a lot of people. You can just put them in a folder. And then instead of 50, you have 15 that you actually really need to respond to. Okay? So organize it in that way. A lot of you may also have some voice recording app that people can have notes. I know most counties use something called Dragon. You don't have to type your notes. You can use the voice recorder. There's also, I've been using iPad for my notes right now. iPad will also convert your handwritten notes to text. So a little bit, more my savvy people in the room. And then the lovely AI feature that AI is coming and it's already here, right? There's when you select your text in Microsoft Word and you right click it, you'll see the option for writing skills and you can have it proofread, make it concise, make it friendly, make it professional. Check it out. It was like life changing for me. And then try to have a full day if you can for a work office day. Try in the quotations because I know sometimes you can't try. And the last one I'll say is task. We in our mind think we're super social workers and we're like, I'm going to finish this whole court report today. That's 5 steps. You know why that's 5 steps? Because I got to call the service provider and then I got to figure out if my parent, if I've seen the kid and I've entered the contact note or not. So I have put 5 tasks as a 1 task. And by the end of that day, I'm looking at that task being like, damn, I didn't do anything. I didn't do anything. And so when I say task, I really mean I need to email this person task. I need to return these phone call task. Like I really genuinely mean task. Don't be sitting there and being like, I'm going to clean my whole office today. Like me. It doesn't work. And then finally, just a couple more things. If you are not, how many of you have heard of the Pomodoro method? Probably some of you have had. My goal, it doesn't have to be 25 minutes. It could be 40 if you're really in a flow. But the hope is that it's focused. That's what I really want to say. So I literally used to put a Post-it on my phone so that I couldn't see my messages because I needed to be focused. Or on my cubicle, I had a sign that said, do not disturb, please, because my lovely peers will come want to talk to me. It's like, no, I really need to do some work right now. So put a little do not disturb outside. But allow it to be focus time and you're cutting out distractions. And then the other thing I want to say about managing time is my lovely college students in the room, you have had to be organized already. Yes? Yes, right? You have school, you have internship, you are about to get a job, you are already organized. Otherwise, you wouldn't be in grad school. You already have a system that you already have for organization. Do not go into child welfare thinking, you know what? I am no longer going to be a procrastinator today. I'm going to start a whole new system and I'm going to start child welfare. No, don't do it. Because what's going to happen is you're going to start child welfare with own culture, own language, acronym, alphabet soup galore, and here I am trying to start a new organization system. Don't work. So if you're using Google, just modify it to Outlook. If you already have a planner that you write into things, that's what you get to modify. Do not come into child welfare, and I say this with a lot of love, I really do. Do not come into child welfare and start a whole new system because you're going to burn out just because that system is not something you've practiced. Questions or comments so far? How are we doing in the live stream? And I almost lost my clicker. Okay. All right. Couple more. And these are the self-care strategies. Positive affirmations. How many of us know about affirmations? Remember, I told y'all, none of this is miracle. This is just friendly reminders. Y'all know this, right? When we are new, and just to center us on the definition of positive affirmation, it's self-affirmations that are supporting our positive self-talk, so moving away from that inner talk and hoping for creating positive change. So it's helping our brain train in ways to be more resilient, more confident, and with practice, they can really support us in our sense of self. So when we're new, one of the first things you're going to have is imposter syndrome. How many of you already struggle with that? I do. I'm sweating bullets right now. I really am. You can't tell, but internally I'm sweating bullets. Um, Imposter is real. When you're new, it's taken, it's like done a camping site, brought its whole gear, and it's like ready to be like, I'm here, sitting here for 6 months with you, because it's on one. Our self-doubt is really high when we're in a new position. If you switch programs, your self-doubt also goes up. And so what also happens is we start internalizing all of that. And it's important that we have some affirmations that we can center on that pause and slowing down. So here are some of my affirmations. I can do this. It's okay. I'm sweating, but I can do this. I'm doing the best with where things are at. This one really has held me. I don't have to make the decisions alone. In child welfare, none of you are making your decisions alone. Your supervisor signs on it, your manager signs on it, the Department of Child Welfare director signs on it. You don't make those decisions alone. You don't need to be a super social worker and make those decisions alone. Child welfare is a beast, and it's normal to have a learning curve. So I want you to take a minute, write down your affirmation. This is my words. You don't have to share it with anybody. But what do you want to center on? You could use my words, or you could find your own. All right, and just two more. I want to center on self-compassion and mindfulness. I truly believe, and you are going to see a slide, self-care and self-compassion is a marriage to me. They don't happen individually. So when you think of self-compassion, there are three elements. Dr. Kristen Neff has done a lot of work on self-compassion. Check her out, NEFF. The ability to be supportive of ourselves. And so they have three elements. Three elements. One is practicing kindness towards ourselves. How do we speak to ourselves in a kind manner? And then leaning into common humanity. This is why when you talk to someone of your peer, when something's going on, it actually allows you to see, oh, I'm not alone. There's something else also, other people are also going through this. And then we'll talk about mindfulness in just a second. So if you're new to self-compassion and you've never done it, when you start noticing that you are being negative to yourself, think about how you talk to your friend in that situation. Because most of us, I'm pretty sure, would be a lot kinder to our lovely friends than to ourselves. And so then say that back to you if self-compassion is new to you. And like I said, self-compassion and self-care really go together. I can't go on a walk and the entire walk tell myself I'm doing everything wrong. That doesn't work. We're still going to burn out. So finally, mindfulness practice. This is where we're acting on the practice of here and now and without judgment. So if you're new to mindfulness, try a guided meditation, like a body scan, because that can be really helpful. And also, it really helps our self-critical piece. So there are a couple deep breathing exercises that I'm going to just show you. We're not going to do all of them, but box breathing. So let's try this. 4 breaths inhale, 4 breaths pause, 4 breaths exhale, 4 breaths pause. The Navy SEALs use that one. 4-7-8 breathing is used in yoga. Inhale for 4, pause for 7, exhale for 8. This one, diaphragmatic breathing, has saved me. Like, I legit am alive because of this. I'm not even kidding. It has saved me in so many occasions where I'm like, I'm about to do something, I'm about to tell you something. Okay, let me breathe. So belly breathing, diaphragmatic breathing, as we know, hand on the way I do it, and if you're new to it, like sleep on a bed or something so you can really see it, but hand on your belly, hand on your heart, and you're trying to breathe from your diaphragm. Guess what? If you take a virtual training, my live virtual crew, none of y'all can be seen above your head. Put your hand on your belly and breathe. No one knows in that supervisory meeting where you want to say something sideways that you're belly breathing so that you don't say something sideways. And then finally, if you really want something structured on mindfulness practice, you want to make sure you take the mindfulness-based stress reduction course. A lot of us with our health insurance, whether it's Kaiser, Sutter, Altabates, you can go through the 8-week program. It's evidence-based for sure. I want to center on gratitude practice. So when we burn out, one of the first things also falls off is I'm more focused on everything that's not working well. So gratitude practice, as you know, we want to reflect on our wins. And we want to think of all the positive ways and share our appreciation. So mindfulness practice and gratitude practice, I started in 2017 when I was going through something really challenging personally. And the mental health professional in me is like, I know the research and the evidence for gratitude and mindfulness. The human in me was like, screw the whole world. I don't want any of this. I don't believe any of this. So I actually didn't connect to the word gratitude. So I centered on, I'm going to write down 3 things that made me smile the day before. That's what I centered on because I didn't connect to the word gratitude. What do you mean grateful? There's nothing to be grateful. And so I would write, found a parking spot in downtown Oakland, which before the pandemic, listen, I can smile about that. So find something that you do. So you've heard a lot of things. And so in closing, you've heard a lot of things. I want you to take a moment, and I would love if you want to share back. What's your one action item that you're going to do today? You could pick gratitude, mindfulness, affirmation, anything you heard. What's your one action item? And you don't need to pick 5. One will get you the domino effect you need. So take a moment. And if anybody in chat wants to share, that'd be lovely too. So I'm going to give you a minute. Anyone open to share? What's their one action item? Yes. Because you're like, I'm cleaning the whole house. Yes, I know. I love that. Others?
In the chat, we would like to try mindfulness and daily affirmations.
I like that. Okay. What about for you?
Oh, I got a mic. Word after, give yourself grace, because for the second years, we about to graduate.
That's something to celebrate. That's a win that we want to celebrate. Anyone else?
Emphasizing on self-care and mindfulness.
I like that. I like that. And I saw a hand there and a hand here. Yeah.
I was gonna say I really liked, setting that one hard boundary. So I'm gonna.
Don't pick 5. It'll burn you out. Any other ones? Final one. Yes. Oh, you want a whole training for that? Yes, absolutely. Okay, I like that. Oh, sorry, say?
Sit a moment, 10 seconds.
Your mic cut out, but just say it out. Oh, yeah. I like that. I like that. Yeah.
Self-talk is a little different than affirmations, but it's supposed to be more effective if you use your name too. Like you
Yes.
say, look, Amalia, you could do this. You have to say the name.
Yes.
Talking to. Who are you talking to?
I love that you said that because in my head, right before I was coming, you're like, Avni, you're okay. You got this. Just put on your damn lipstick and come downstairs. You're going to be okay. Yes, absolutely. Anyone else? Did I see a hand back there for you? Okay. All right.
A few more from the chat. We have self-gratitude and self-forgiveness.
I like that. Self-forgiveness. Woo. We could talk about that too.
And then for me, what really resonated was taming the inner critic. So talking back to it, just like you were saying. Yeah.
I got all 7 types of inner critic in me. All of them. Perfectionist, taskmaster, conformist, everybody. Yes. Oh, I like that. I like that. I like that. Follow me on socials. Y'all have been lovely. I know there's Q&A that's coming up. If you have Q&A, but like I said, none of these are grand. They're micro, and they're micro for a reason. There's a lot of study done on happiness, by the way, by Dr. Laurie Santos. She has a podcast called The Happiness Lab, if you haven't listened to it. There's a lot of research on happiness is also micro moments. If we actually focus on I'm going to be happy, it actually makes us less happy. So it's in the wonderment and the joy and the awe. And so I really hope that you center on those micro moments. And as you start your career, I really hope you center on you got this. Every single one of you. I tell my when I train Common Core, I tell child welfare workers, you got the job. You got the job. You know how to assess. You'll build your practice. Just allow yourself to recognize you've got your own assessment skills, whether it was in nonprofit, whether it was in residential, you have the skills. You're just adapting it to child welfare. Child welfare is the hardest, I truly do believe. If you can do child welfare, you can do anything. You really can. You really can. Because child welfare is the only agency, one of the only agencies that also is connected to juvenile court. Every single thing you do is documented and is seen as reasonable efforts, active efforts, or not. That's the only agency. Other social work fields, social work positions may not be connected to court. That's why our jobs is stressful. So I hope y'all, take good care of yourselves. And I don't know if we even have time for we do? Okay. All right. Any questions? Yes.
It's more of a comment because I was like the 10 or the 12 on the burned out. Okay, so speaking from experience, I've lived experience with burnout. The peak of my burnout happened in 2020, but it was because I was forced to violate my self-care practice. So my self-care practice was don't bring work home, and I was told to work from home.
Yeah.
For about 2 weeks, I went back and forth with my supervisor in adoptions about why I can't work from home. She pretty much said, well, you have a job to do. When I tell you, I almost quit on the spot and said some words I won't repeat on the microphone because I said, absolutely not. That's the only way I was able to stay in child welfare is because I never brought work home. So in 2020, I found out that I didn't have a choice. And I said, if I'm going to bring work home, it's going to be on my terms. And so I created boundaries for my house. My work phone stayed in my office.
Yes.
My case files never came home, but my court reports did, but it stayed in a certain area of my house. And I never worked from my bedroom. I never worked from my kitchen or a common place. It stayed in a portion of my house. And to this very day, I haven't violated that practice. And I'm going to let y'all know, because it's post-2020, but working from home is here to stay. Create boundaries. Work doesn't have to live in your home while it's in your home. And if you don't have the luxury because of space and proximity and things like that, really take some time after you leave work to walk outside and restart your day entering into your house as if you're coming home for the first time.
I love that.
That's my advice because that's the only way I'm able to continue.
Thank you. There's like so many gems in there, but I love that.
Hi, you know me. I'm a student of yours, but
I
there's
know
something
you.
that you have shared in your classes with us about when we do get burnt out in a certain department.
Yes.
But you didn't share that yet.
I
So
didn't
would like you to
share that.
I would like you to share that.
Yes. So one of the reasons, so I was a Title IV student and I'm like 3 years and I'm good. I'll do 2 years and I'll do a year to figure my life out and then I'll leave child welfare. I stayed for 10. I stayed for 10 because I kept moving around. So if you burn out, try a different program. It's the same job. You're on the same floor with the same people, but you're seeing child welfare from a different lens. So if you are like me, try a different unit, try a different program, because that will actually help you reset. It was the resets that I honestly wasn't burnt out when I was picking the positions. My busy body is like, oh, opportunity, I'll put my name in the hat. And then I got the opportunity. It's like, oh crap, I have to go now. I can't say no. So I was fortunate that I wasn't like burned to a crisp when I had those moves, but it really allowed me to stay as long as I did in child welfare. So yes, thank
Okay. Hello.
Hello.
I mean, it's just a comment. I just want to say thank you for also like sharing like your personal like vulnerability about being an eldest daughter. I'm also, especially being an eldest daughter of color, and like there's been times like I just want to share this positive affirmation. There have been times that like you feel like you're like a cultural minority, and like these systemic frameworks do not fit to give you the help that you yearn for or the services that you expect, like in terms of like navigating through your career and like personal life. So it just makes me feel less alone as like an eldest daughter of color, that they're like even though we are drawn into this field to work with people and help people, we also have that free will to be able to advocate for ourselves and our self-care. So thank you.
I love that. I love that. Write that down somewhere for you on your phone. So when you do have those moments of like, oh crap, I have to say yes, you'll remind yourself about that because you said it so beautifully. So memorialize that somewhere.
Thank you so much for your presentation. I was, on one of the other presenters, so it just flowed so well with what we were sharing as well. And something that made me think of, and I just wanted to share this, especially with all of this, just everyone here, is, and this is reiterating this, is that burnout is not inevitable. And I think sometimes we think, oh, social workers are always talking about how there's so much burnout in social work and everything, and there is, and that's why we talk about it, but it doesn't have to be. And just as somebody that's been in the field for over 20 years, I didn't raise my hand for burnout. I've never experienced it. And that's not to say because of like, I just worked for the most amazing places, which but mostly because of this, mostly because of everything that you're sharing, all of these things. If you are intentional about doing these things, you can actually bypass burnout. You don't have to experience it. So thank you so much for sharing that, because if we're intentional and we do this, we don't have to.
Yes, I was working 60 to 80 hours and I didn't burn out. I burnt out. The burnout to Chris was because of bureaucracy. It wasn't because of like this, I have 3 jobs. It was because of the moral distress. Okay. All right. Anyone else?
I think we have time for just one more question before we move on. Okay, I see your hand. Yes.
Hi, I was wondering if when you experienced burnout, did you feel bad about yourself, or did, like you like diminished view of yourself and your self-worth? And if you did feel that way, how did you overcome that? Like accepting, I burnt out.
Yes.
Now how do I get over it?
Yeah. So that oldest daughter thing is like, oh my God, me? Like everybody, like that's a everybody else thing, not a me thing. Like, how does it happen to me? Yes, absolutely experienced that. And one of the ways that I crawled back out of it was one, reminding myself with those affirmations and the like compassion, but also finding my people. I have really good friends and community in terms of social work peers and also outside. And they can sometimes be a reminder that you're not a failure. And so sometimes I had to find my friends to remind me that I'm okay and that I'm not a failure.
Actually, we have time for another.
Sorry, I just wanted to thank you because I didn't know there was a word for it. So like the same with you, it's like the bureaucracy of it. I'm not burned out because of my job. I'm not burned out because of what I'm doing. I love what I'm doing.
Yeah.
But the fact that my administration is a certain way, it feels like a constant struggle. And you taught me today that that is not something I made up. Like there is a word for it. It's moral distress.
Yes. Yes. And check out more research on that. There's a lot more research on that. Check out more research. I want to thank you, everybody. Thank you so much.
Thank you, Auntie.